Hello everyone. So today I'll be presenting on healthcare informatics in Guatemala. So through this presentation, I hope to share both the healthcare challenges Guatemala faces and the progress and potential we are beginning to see through the use of digital health and information systems. I think understanding how technology can improve healthcare is especially important for countries like Guatemala, where access to medical services is not equal for everyone. And also by looking at real examples, we can see how even small digital improvements can create meaningful change. So I think this presentation connects to a larger conversation about equity, innovation, and global health collaboration. So here is the outline for today's presentations. First, I will introduce Guatemala briefly to provide cultural and geographic context. Then I will share key demographic and economic data, followed by the current state of the healthcare system and public health challenges. And after that, I will talk a little bit of healthcare informatics, where Guatemala currently stands, what systems are being used, and the barriers to implementation. And finally, I will discuss about the future opportunities and perspectives for improvement. So Guatemala is located in Central America, bordered by Mexico, Belize, Honduras, and El Salvador. It is a country rich in Mayan cultural heritage, vibrant traditions, and beautiful landscapes such as volcanoes, Antigua and Tikal. However, despite its cultural richness, Guatemala struggles with economic inequality, poverty, and uneven access to healthcare and education. So this contrast between cultural wealth and limited public resources sets the stage for many challenges I will talk about. Guatemala's population is around 18 million people, with Guatemala City as the capital. An important characteristic is its linguistic and ethnic diversity. Spanish is the official language, but there are 24 indigenous languages, mainly Mayan. So about 52% of people live in urban areas, while the rest live in rural regions. So many live in remote mountains. So this urban-rural divide significantly impacts healthcare access too. Economically, Guatemala is considered a lower middle income country. So key industries include agriculture, textiles, tourism, and a major contributions are from remittance, money sent from family members working abroad, which make up nearly 20% of the GDP. However, about 55% of the population lives in poverty, especially in rural and indigenous communities. So this economic landscape affects both the funding and quality of healthcare services available. So now looking at the structure of Guatemala's healthcare system, it is divided into three main sectors. The first and largest is the Ministry of Public Health and Social Assistance. So this system is meant to serve the general population and reaches about 70% of people. However, because resources are limited and demand is high, public hospitals often overcrowd, understaffed, and have long waiting times. The second sector is the social security, which covers around 15% of the population, mainly formal workers and their families. So social security facilities usually have better infrastructure and more consistent access to medications, but only individuals employed in the formal economy are eligible, which excludes many rural and low-income workers. And the third is the private healthcare, which tends to be concentrated in the urban areas, especially in Guatemala City. So private clinics and hospitals generally offer faster and higher quality services, but they are too expensive for most Guatemalans. So access to private care often depends on a person's income level. The most significant issue across all sectors is the urban-rural gap. So people living in the capital or largest cities can reach hospitals and specialists relatively easily, while many rural and indigenous communities must travel several hours or even a full day to access basic medical care. So this unequal access is one of the core challenges that digital health and healthcare informatics are trying to address, which lead us into the next part of the presentation. So Guatemala faces several serious public health challenges. One of the most critical is the chronic malnutrition that it's affecting 45% of children. It is the highest rate in Latin America. There is also limited access to services in remote areas, and the healthcare system struggles with resource shortage. And at the same time, non-communicable diseases like diabetes and hypertension are increasing, requiring long-term continuous care, which is difficult under the current system. Healthcare informatics in Guatemala is still developing, so most hospitals continue to rely heavily on paper-based medical records, meaning patient information is often fragmented and hard to share. There are several barriers to digitalization, including limited internet access, low digital literacy, and lack of interoperability among the systems. So, however, there are some promising initiatives like the National Health Information System that collects data on immunizations, diseases, and maternal health. Also, telemedicine programs are connecting rural clinics with specialists in major hospitals, and electronic health record pilot projects are being tested in some public hospitals. An example of informatics in action is the telemedicine program linking rural health posts with specialists at a hospital in Guatemala City. So nurses in remote communities uses digital tools such as mobile ultrasound and electronic patient forms to send medical information to specialists in real time. So this program helps detect high-risk pregnancies early and reduces unnecessary travel and strengthens reporting into the SNIS system. So this is a strong example of how technology can bridge the rural-urban healthcare gap, but is still in progress. So looking forward, Guatemala has important opportunities to improve healthcare through informatics. So this includes expanding digital infrastructure, training healthcare workers in data management, and scaling EHR systems nationwide. Data analytics could help allocate resources more efficiently, especially in rural areas, and also collaborations among hospitals, universities, NGOs, and international partners will be key to sustainable progress. So thank you very much for your attention, but before closing, I would like to acknowledge the important role Taiwan has played in supporting Guatemala's healthcare development. So Taiwan has collaborated with Guatemala through medical missions and training for Guatemalan doctors and nurses, donations of medical equipment and hospital supplies, also support for telemedicine programs and digital health capacity building, and scholarships for Guatemalan students to study health and medical sciences in Taiwan, which includes myself. So these collaborations are meaningful because they help strengthen Guatemala's healthcare system not only at a technical level, but also through long-term knowledge exchange and human development. So I am personally grateful to Taiwan for the opportunity to continue my education here, and I hope to bring this knowledge back to contribute improving healthcare access in my country.